And we are mainly focusing on what's going to occur that's directly related to New Choices Waiver. Mainly when we're looking at care plans, applications, referrals. We're not going to touch as much on items in PRISM that are going to be over billing or claims, but we'll have a couple of resources for you. So let's get started. Once again, today we're going to go over just generally what is PRISM. Some of you have probably been hearing about PRISM for years, while others may just be hearing about it now. So we're going to be able to provide an overview of what PRISM is, so that way we're all on the same page and know what to expect moving forward. We're going to discuss further about what's going to be happening during the freeze, what processes may be affected, an overview of changes that will occur once PRISM goes live, and then, of course, the training and resources that are going to be available to you guys, both during the freeze, in preparation, and after. So what is PRISM? PRISM stands for Provider Reimbursement Information System for Medicaid. It's a cloud-based Medicaid management system that manages things like provider enrollment, Medicaid eligibility, claims adjustments and payments, prior authorizations, and other Medicaid information. PRISM is going to be used by Medicaid providers, including case management agencies, and of course, state users. Currently, the provider enrollment component of PRISM is already available. It was implemented back in 2016. All of the other components, the Medicaid eligibility, claims, prioritization, are going to be available starting April 3rd, 2023. So that is what we are referencing as PRISM Go Live, when all these other components will be available. To support conversion of data from our current systems to PRISM, we're having a freeze of system functions, which will occur from March 13th till April 2nd. And we're going to discuss a little bit about this further at this time, but that's what we're referring to when we mention the freeze. You may have noticed that when we are listing what PRISM entails, it doesn't quite include care plans yet, and that is where PEGA comes in. PEGA is a subsystem of PRISM, and it facilitates case management. For New Choices Waiver, PEGA will be the new care plan system, but it does a lot more than just managing care plans. You'll also use PEGA for incident reporting, processing referrals, completing health screening reports, level of care determinations, and disenrollments, among other things. That means that a lot of the manual processes that we are currently completing via email are now going to be done in PEGA. The training and resources that NCW will provide will be focused on PEGA, not the larger system of PRISM. PEGA is going to be able to be used by, of course, case management agencies and state users. Other waiver providers do not have access to PEGA, but as mentioned previously, they do have access to PRISM and the information PEGA shares to PRISM. We also want to note that PEGA is not going to replace things like log notes, and it doesn't track case management units to tell you how much to bill for. One other system that we're going to touch on is going to be the application intake. It's another subsystem of PRISM. And in this system, individuals will be able to submit applications to New Choices Waiver or other waivers and check the status of their application. It will also serve as a way to submit appeals or complaints for Medicaid, not just waivers. Although the application portion is specific to waivers. Application intake is also going to be accessible to anyone. So those applications can be submitted by the member, their representative, and complaints or appeals can be submitted by any provider, any member, or individual. So that's the overview. We're going to dig into a little bit about what's happening during the freeze. Once again, to support conversion of data from the current systems for Medicaid into PRISM, we're having the freeze of systems occur. So it's just the standard process for system conversion that will impact operations. The Medicaid systems will freeze operations from March 13th through April 2nd, 2023. If you're looking for more information regarding the freeze that we are not going to cover and is not directly related to New Choices Waiver, you can find that additional information on the Medicaid PRISM website, which is medicaid.utah.gov/PRISM. On there, you can find more information like how claims are being done, any prior authorizations, and what systems exactly are going to be affected during the freeze. But let's focus a little bit more on New Choices Waiver. For our work, what will not occur during the freeze? So we are going to, as Marisol mentioned, pause applications. So no new application is going to be accepted starting March 11th. And then any incomplete applications are going to be paused during the freeze to allow us time to transfer over to PEGA. For care plans, the last day to submit is going to be tomorrow, which is Friday, March 3rd, and they need to be submitted by 11:59 p.m. After March 3rd, the care plan system is going to be available as read-only. For any care plans or services that were not submitted before March 3rd, is going to be submitted as a care plan starting April 3rd when go live occurs, and then will be reviewed and processed for approval. We do realize that there's going to be some initial and annual care plans that may not be possible to submit by Friday, and will have a start date of April 1st. These care plans can still begin and services can still start on April 1st. However, if there is a service that normally needs prior approval or the units requested are outside the normal range, then you can send these care plan requests to the New Choice Waiver Provider Support email. These are going to be for services such as chore services, environmental accessible adaptations, specialized medical equipment, or community living supports. And then, of course, the ones that the units that are outside the normal range, which would be something like 30 units of case management, where you normally, when you submit those, we start asking additional information and has to then go through management approval. We're going to provide additional guidance after this training to outline exactly what we need from you in order to process these. So what's still going to happen during the freeze? We're still going to be processing incident reports and have them submitted through the NCW incident email in a timely manner. Disenrollments are still going to be able to be processed during this time. However, when PRISM goes live on April 3rd, we will need to then enter any disenrollments that occurred into the system in order to end their care plans. Health status screening supports still need to be sent in through the normal process. Any agency transfers can still occur. We just need to update the care plan after go live. Any hearings or appeals will still happen. Grievances, we still welcome to be sent in. And then, of course, we have PEGA training, where we'll be providing additional training and resources for you guys to use. So let's dig in a little bit more to what is actually going to change with PEGA. And the answer is a lot, but it's going to be a good thing. Before you get too anxious, overall, the tasks that you guys complete as case managers, like submitting care plans or completing a health status screening report, those are going to stay the same. What is going to change is where we complete them and how we share information. PEGA will help facilitate continuity of care by having the information for one individual in a single place. Many forms are going to be electronic, and the ones that aren't are going to be uploaded directly to PEGA instead of sent back and forth in emails. There's also going to be some automation of tasks and an easy way to check the status of a task. To make these changes a little bit more concrete, let's take a closer look at PEGA. So there are 9 main activities called cases that are completed in PEGA. Starting April 3rd, these processes, as we review them, will go and move to PEGA, which means we normally communicate and share documents through email. It's going to be done in PEGA. So the 9 main activities are going to be an initial enrollment, which covers both the referral process and an initial care plan, the annual care plan, any care plan amendment, which is the term used in PEGA. You guys may refer to it as a update or a significant change in a care plan. Any inpatient admission, so you can report those. Incident reporting, substantial change in health status, change in living arrangements, agency transfers, and disenrollments. All of these cases completed for one individual is going to be able to be reviewed within PEGA. So when we look up a single individual, we're going to find something like this, where it shows all the assignments that were completed for one person. You can see for this one that you can look at whatever task was completed, whether it was a care plan, disenrollment, or an incident report, who it was assigned to, and when it was assigned on, and when it's due. You can also see, here's an example of an incident report that is active. So you can see what's happened, what's been completed, and the status. If we look at one of these cases, initial enrollment, a little bit closer, the initial enrollment has tasks that are automatically generated. When an application is submitted using the application intake system, a task is generated in PEGA for the New Choice Waiver team to review. We'll be able to review the application for completion and then to review it for if it can be accepted for New Choice's waiver. Once we complete our review and accept the application, it'll automatically generate a referral. You guys will find it in your login for PEGA as an agency case review task. Other tasks include creating the level of care determination, lease disclosure form, and once that's completed by the case management agency, it automatically generates a task for us in the New Choice Waiver Program office to submit the 927. Other tasks are generate the free forms, recording comprehensive care plan, for the state to approve a comprehensive care plan, and then to upload it. So all of these are automatic tasks that will be generated and assigned once the previous task is completed. So if we go back to that view we had before, down where we have the incident report, you can see that the current task is to notify the client and that it was assigned to the case management agency. If it's assigned to you, it'll give you the option to automatically jump in and begin the case so you can work on the task and save any progress that has been made. If this was a task that was assigned to, say, us at the New Choice Waiver Program, it would have it here. So you would know where we were in the process and where the task was assigned to. But this isn't the only information that can be reviewed when you're looking at a individual's information. You're also going to be able to see information related to the care plan. Because PEGA is a part of PRISM, where claims are adjudicated, we'll be able to review care plan utilization within PEGA. So when a care plan is completed, A prior authorization number will be generated in PRISM. Providers will be able to view those prior authorizations in PRISM and use them to bill. Once claims are approved, those will be reflected back here in PEGA, and you'll be able to see the units that have been utilized thus far. For prior authorizations, because they're automatically generated when a care plan is approved, though the service authorizations will no longer be needed to be complete and sent to the providers. Instead, they're going to be replaced with these prior authorizations that are auto-generated. And lastly, forms are going to be completed electronically, mostly. Those are going to be things like the level of care determination. There's a screenshot here that kind of shows you, at least for factor A, what that looks like. And you'll be entering in all of these. So that way they can be reviewed in one place for both teams. Other forms that are going to be electronic are including the health status screening report, incident reports, and then for disenrollments, DPF 1s and DPF 2s. Even for forms that still need to be completed, like the rental agreement or other deadline day docs, the MDSHC, those can be uploaded to PEGA. This means the forms no longer need to be sent via email or fax. When you upload them here in PEGA, we will also be able to view them. And this just shows you a little bit that how they are saved to be able to review it at any time. This also means for things like agency transfers, you will be able to have a complete review of documentation that has occurred from the previous case manager to be able to review when you're trying to, during a referral. So that's just a brief overview of PEGA and some of the changes in the processes that you guys are going to see. We're going to go over a little bit about the training and resources that are going to be available during the freeze. Once again, we're really going to focus on PEGA when it comes to resources that New Choices Waiver will provide you. There are other training available for general tasks in PRISM. And many of these resources and any live trainings are going to be found on the Medicaid PRISM website. These are going to be things like navigating PRISM, submitting claims, viewing prior authorizations, and provider enrollments. So if you have staff for billing, these are going to be the resources that will help them. The Medicaid PRISM page is that medicaid.utah.gov/PRISM. Here, you're going to find a lot of information if you scroll through their page, including FAQs about the freeze. But if you select the PRISM provider training box highlighted, it's going to take you to this page, which has the provider training calendar. This training calendar will list any live trainings that will be held by different offices in Medicaid. And as you can see, those will include like the prior authorization trainings are ones that are happening a lot right now. Any updates, changes, or additional trainings are going to be here. And any recorded trainings can also be found on this website for those general PRISM trainings. But for New Choices Waiver, what are we doing? In addition, of course, to today, just a brief overview, we're going to provide e-learnings, which are recordings that walk you through parts of the system in PEGA. And we're adding those to the New Choice Waiver website. And we'll notify you once those are available and suggest a order in which to complete them. We also are going to have recorded trainings where it'll go a little bit more into detail of how to complete certain processes within PEGA. Both the recorded trainings and the e-learnings will address tasks like submitting a care plan, completing a disenrollment. We also have 3 additional trainings that will be completed with the super users. Each CMA has selected at least a super user that will participate in 3 work groups in March. These work groups are going to be focused on trainings as well as preparing for go live and making sure that we account for information that you will need in order to be ready for go live. We would encourage you guys to reach out to your super user if you have any questions on any of the trainings that we review during the freeze or changes in processes so that they can bring them to these meetings. Once go live happens on April 3rd, you'll be able to go into the system. We are going to have a go live checklist that will be provided to you starting March 30th. And we're going to previously review these with the super users to make sure they cover everything. And these are just going to walk you through a few initial steps that will need to be completed in PEGA. These will include things like admin going in and making sure that all of your staff have been added. We've been working with you to hopefully power load everyone into the system. But in case there was a typo or something that couldn't occur, those will need to be added, or any staff that have come on board since then. It'll also include additional items that'll need to be done by the case managers, like reviewing any care plans or disenrollments, or going in and just making sure that the data was transferred correctly. We don't see that being too much of an issue, but it'll be a way for us to make sure. We're also going to have FAQs for you guys to be able to review that will touch on common questions that we heard during the freeze. And we're going to have a PEGA desk aid document. This is a PDF that provides a step-by-step description with pictures of tasks that you'll be completing in PEGA. That way you don't have to constantly go back to a full recorded training to remember what steps to do next. And hopefully this will provide a good reference that you guys can use daily as you're getting used to the system. Finally, we're going to have open door meetings the first week of go live, where super users can bring common problems or process questions that your guys' teams are having. We know that the change is going to be a learning curve for us all, and that there's going to be some bumps along the way, but we're here for you, everyone here on the New Choice Waiver team, to support you and to help you along. All of our emails are still going to be live. We will still be on the phones regularly Monday, Tuesday, Wednesday, and Friday from 9 to noon. And we are happy to talk to you guys about any questions that you have or assist you in any problems that may be occurring throughout this process. So that's the broad overview. Like I said, we are going to be following up with additional information when those trainings are available after today. But that concludes the overview.